Part A. Extract 1. Questions 1 to 12. You hear a pharmacist talking to a patient called Mihira.
Good morning, Mihira. How can I help you today?
Good morning, Robert. I'm hoping you can help me. I've had this really persistent cough for about a week now, and it's making me quite miserable. It started after I had a bit of a cold.
I see. And how would you describe it?
It's mostly a hacking cough, especially at night. It often leads to a sore throat, which is probably the worst part. I feel a constant tickle at the back of my throat. I also have some general aches and a bit of a headache, but the cough is the main issue.
A week, you said? And any other symptoms, like a fever or shortness of breath?
No fever, thankfully, and no shortness of breath, but sometimes the coughing fits are so intense they leave me feeling quite exhausted. I'm getting fed up with this. I've also noticed my voice is a bit hoarse from all the coughing.
Understood, Mihira. Have you tried anything for it so far?
Yes, I've been gargling with salt water, which provides temporary relief for the throat. The irritation does ease briefly, but it often returns with the same sensation. I also tried some honey and lemon drinks, but they only soothe it for a short while. While they offer momentary comfort, the cough continues to flare up unexpectedly. I took some over-the-counter cold and flu tablets for the aches and headache, but they haven't touched the cough.
Okay. And Mihira, are you taking any other regular medications? Or do you have any other health conditions I should be aware of?
I take medication for mild asthma, salbutamol for when I need it, but I haven't needed to use it more than usual with this cough. I also take a daily multivitamin. Other than that, I'm generally healthy.
That's helpful, Mihira. Given your symptoms, it sounds like a post-viral cough, which can linger for a few weeks. The hoarseness and sore throat are very typical.
So it's nothing more serious?
From what you've described, it's not. For now, I'd recommend Delsym, a cough suppressant, specifically one containing dextromethorphan, to help calm that hacking cough, especially at night. It's important to keep your throat moist.
Thank you, Robert. That sounds like a good plan.
Extract 2. Questions 13 to 24. You hear an endocrinologist talking to a patient called Mihira.
Good morning, Mihira. What brings you to see me today?
Morning, Doctor. Charles. Well, I'm here because I've been feeling quite unwell lately, and my GP, Dr. Emily, suggested I come to you. The main issue is this unexplained weight gain, despite not really changing my diet much. I've put on about 5 kilograms in the last 6 months, and it's quite alarming.
I understand. Can you tell me more about any other symptoms you've been experiencing?
Absolutely. Besides the weight, I'm constantly thirsty. I feel like I could drink gallons of water, and it never quite quenches it. Because of that, I'm going to the bathroom all the time, particularly at night, which is really disrupting my sleep. I'd say I'm urinating at least 4 or 5 times during the night. This frequent waking disrupts my sleep more than I realized. I'm also experiencing a lot of fatigue throughout the day, a kind of bone-deep tiredness that just doesn't go away, even with rest. And especially when reading, my vision seems to be getting a bit blurry.
That's a clear set of concerns, Mihira. Have you noticed anything unusual or frequent infections?
Oh yes. I had a small slow-healing cut on my finger from gardening about 3 weeks ago. It's still not fully healed, which seems a bit unusual. And I seem to be getting yeast infections more often than I used to. It's frustrating.
And what about your diet and exercise habits? Any family history of similar conditions?
I try to eat healthily, but I do have a bit of a sweet tooth, I'll admit. And with the fatigue, exercise has really fallen by the wayside lately. As for family history, my mother was diagnosed with type 2 diabetes in her late 50s, and my maternal grandmother also had it.
I see. Have you tried anything to manage these symptoms yourself before coming in?
I tried cutting out sugary drinks for a while and drinking more water, but it didn't really help with the thirst. I also tried going for walks, but the fatigue just made it too difficult to keep up. I just feel constantly drained.
Mihira, your symptoms, combined with your family history, strongly suggest type 2 diabetes. We need to do a fasting blood glucose test to confirm this. I'll arrange for an HbA1c test and possibly an oral glucose tolerance test. This will give us a clear picture of your current glucose metabolism. Once we have those results, we can discuss a definitive diagnosis and a management plan.
Part B. In this part of the test, you'll hear 6 different extracts. Question 25. You hear a nurse called Mihira talking to a colleague.
Morning, Mihira. You look buried in that tablet. Another glitch in the new reporting system?
Morning, Olivia. Not a glitch, exactly. It's more like chaotic accuracy. I submitted 3 incident reports yesterday. One duplicated itself, another disappeared mid-save, and the third attached itself to the wrong patient profile.
Oh no. I thought the system was supposed to streamline documentation.
That was the idea. They say it reduces manual entry errors, but honestly, with all the patient ID mismatches and autofilling the wrong vitals, I'm spending more time fixing entries than before.
So you're not confident in it yet?
Not entirely. But to be fair, the medication administration logs are easier to audit now. At least that part is working.
Still, if you're second-guessing everything it records, it's adding mental load, Mihira.
Exactly. And patients notice delays when I double-check their charts. But the manager insists it's a learning curve and that our feedback is being collected for future updates.
Classic. The feedback loop that vanishes into space.
Precisely. Until then, it's a high-tech mess wrapped in efficiency slogans.
Question 26. You hear a doctor called Mihira talking to the team.
Team, we've had 3 near misses this week due to documentation errors. The diabetic patient's insulin dose was recorded as units instead of milliliters. Luckily, the nurse caught it. But the anticoagulant chart had the same issue yesterday.
Wasn't that because the new intern confused warfarin and heparin protocols? The system auto-populated the wrong fields.
Partly, but the root cause is inconsistent abbreviations. For example, QD was misinterpreted as QID in the renal patient's chart. From now on, write daily, in full, no exceptions.
Mihira, what about the post-op opioids? The system flagged a decimal error, 5 milligrams versus 50 milligrams.
That's why we mandate zeros before decimals, 0.5 milligrams, never 0.5 mg. And double-check allergies. The penicillin incident happened because someone overrode the alert.
Question 27. You hear a nurse called Mihira performing handover.
Robert, let's go over Mr. Harrison. He's in bed for. Admitted yesterday with a worsening productive cough and fever. He's 78. history of heart failure, well-controlled hypertension. His main concern overnight was increasing shortness of breath, particularly when lying flat, despite his usual diuretics. We've given him an extra dose of furosemide at 0,400, which has improved his saturation slightly, now at 92% on 2 liters of oxygen by nasal prongs. His urine output was a bit low, around 200 milliliters over 8 hours, which isn't ideal for someone with his cardiac history.
Okay, Mihira, so fluid balance is a concern. Any signs of infection?
That's the tricky part. His sputum is thick and greenish, which points to a respiratory infection. He's also complaining of generalized weakness. His chest x-ray from yesterday showed some bilateral infiltrates, which Dr. Evans suspects might be atypical pneumonia, but his inflammatory markers aren't significantly elevated yet. He's quite anxious about his breathing. We've managed that with a small dose of lorazepam. The respiratory physio will be seeing him this morning. The underlying cause for his current presentation seems to be the acute exacerbation of his heart failure, likely triggered by this new respiratory infection.
So Mihira, the infection triggered the heart failure?
Precisely. It's putting extra strain on his already compromised heart. Keep a very close eye on his fluid status and respiratory effort. We need to encourage deep breathing and coughing, but gently, given his fatigue. Ensure he's sitting upright as much as possible to aid his breathing. Dr. Evans wants repeat bloods this morning, including a full blood count and renal function tests.
Question 28. You hear a GP, Mihira, talking to a community nurse.
Thanks for joining at short notice. I reviewed the home visit reports for the Jameson case. His blood pressure readings are inconsistent again, particularly in the afternoons.
I've noticed. But Mihira, I'm not sure if it's the meds wearing off or him skipping doses. He claims he's taking them, but there are unopened blister packs.
That's the issue. The family says he's compliant, but they're not actually supervising. And now there's talk of dizziness, possibly from doubling doses if he forgets he's already taken one.
So you're thinking non-compliance or overuse?
Possibly both. That's why I need you to adjust your schedule to mornings for a few days. Observe the routine, confirm adherence, and document his actual intake.
I can do that. Should I report any neuro changes directly?
Yes, but focus on identifying patterns, timing, meals, dosage behavior. Once we have that, we can decide if it's a regimen issue or cognition related.
Understood. So Mihira, it's more about clarifying the cause?
Exactly. We need a clearer picture before modifying anything.
Question 28. You hear a GP, Mihira, talking to a community nurse.
Dr. Evans, I'm worried about Mr. Thompson's progress. His lumbar mobility improved after hydrotherapy, but now he's developed new shoulder pain during the prescribed home exercises.
Mihira, could it be compensatory movement from favoring his back? The last MRI showed no rotator cuff involvement.
Possibly, but I'm more concerned about his medication. He mentioned doubling his painkillers before sessions, which might mask important feedback.
That would explain why he overexerted last week. Let's reduce his NSAIDs and emphasize proper form over intensity.
Agreed. Also, his wife reported he's been skipping the walking program, saying it aggravates his knees. But his recent x-rays showed no degeneration there.
Classic fear avoidance behavior. The real issue isn't his joints, Mihira. It's that unmanaged back pain is altering his whole movement pattern.
Question 30. You hear a dietitian called Mihira conducting a session in a care home.
Good morning, Robert. Thanks for meeting with me. I wanted to discuss some observations from my rounds this week, particularly regarding resident hydration and appetite. I've noted a slight increase in unexplained fatigue among several residents and a few instances of minor constipation, even for those on regular bowel regimens. This suggests we might need to reassess our fluid intake strategies across the board.
Good point, Mihira. We've certainly emphasized water intake, especially during meal times. Are you seeing specific residents struggling more than others?
Yes, particularly those with cognitive impairments, like Mrs. Peterson in room 12, who often forget to drink unless prompted. Also, residents with swallowing difficulties, such as Mr. Jenkins, who tend to limit their fluid intake to avoid coughing. My primary concern, however, stems from the overall nutrient density for residents with reduced appetites. We're seeing weight stabilization in many, but for those consuming less than 75% of meals, the quality of their intake becomes paramount. The core challenge is maintaining sufficient caloric and protein intake without overwhelming them.
We've been using fortified milks and adding butter to vegetables for those individuals. Is that not enough?
Those are excellent starts, and I've seen them in practice. However, my assessment points to a need for more consistent, high-calorie, high-protein snacks offered between meals, not just during them, to compensate for reduced meal consumption. This is crucial for preventing muscle wasting and supporting overall well-being. It's about optimizing every eating opportunity. Also, ensuring that staff are equipped to manage dysphagia patients effectively during hydration rounds is key. We're doing well with mealtime support, but consistent between-meal checks for fluids and supplemental snacks could significantly improve outcomes.
So Mihira, more frequent small offerings. I can certainly brief the care staff on that.
Exactly. And reviewing medication side effects that might suppress appetite could also be beneficial. It's a multifaceted approach, but focusing on accessible, energy-dense options throughout the day will address the most pressing nutritional gaps.
Part C. Extract 1. You hear a psychologist, Mihira, and an interviewer discussing the impact of artificial intelligence on human behavior.
Welcome everyone. Today, we're delving into a fascinating and increasingly relevant topic, the psychological impact of artificial intelligence on human behavior. Joining us is Dr. Mihira, a distinguished psychologist with extensive research in cognitive science and human-computer interaction. Dr. Mihira, thank you for being here.
It's my pleasure, Alex. Thank you for inviting me.
Dr. Mihira, to begin, the widespread integration of AI into our daily lives is undeniable. From personalized recommendations to automated customer service, it's everywhere. But what's your take? Does AI truly have a measurable impact on human behavior, or is it merely a tool we wield?
That's a crucial starting point, Alex. To answer directly, yes, absolutely, the impact is profound and multifaceted. It's far more than just a passive tool. Think about how social media algorithms driven by AI can subtly reshape our opinions by filtering information, or how navigation apps, also AI-powered, alter our spatial reasoning and even our decision-making pathways. We're seeing shifts in attention spans, critical thinking, and even social interaction patterns. The constant optimization for engagement, for instance, has demonstrably led to reduced patience and an expectation of instant gratification in many online interactions, bleeding into offline life. The subtle nudges from AI systems are powerful behavioral modifiers.
That's quite a revelation. Dr. Mihira, how exactly did researchers identify these specific behavioral shifts? What methodologies were employed to pinpoint these influences?
Initially, much of the identification came from large-scale observational studies and analysis of digital footprints. Researchers meticulously tracked user interactions with AI-driven platforms, comparing longitudinal datasets before and after significant AI integration or algorithmic changes. This allowed us to correlate changes in online engagement, communication styles, and content consumption with the evolving AI landscape. For instance, the rise in short-form content driven by recommendation engines was directly linked to observable declines in sustained attention during other tasks. More recently, controlled experimental designs, where participants interact with varying levels of AI assistance or algorithmic control, have provided causal evidence. Neuroimaging studies are also beginning to show how different AI interactions activate distinct neural pathways, hinting at deeper cognitive restructuring. It's a complex puzzle, but the evidence is accumulating, highlighting a clear pattern of adaptive behavioral responses to these digital environments.
Given these impacts, both positive and potentially negative, how can we ensure that AI's influence primarily yields positive outcomes rather than undesirable ones? Dr. Mihira, is there a way to steer its development and application?
This is where the ethical considerations become paramount. The key lies in designing AI systems with human well-being at their core, moving beyond mere efficiency or profit maximization. It means prioritizing transparency in algorithms, allowing users to understand why certain recommendations are made or how their data is influencing their experience. It also involves embedding principles of autonomy and agency, ensuring that AI acts as an enhancer of human capabilities, not a replacement or controller. Think of it as coevolution. Collaborative frameworks between technologists, psychologists, ethicists, and policymakers are crucial. We need to define collective societal goals for AI, not just individual corporate ones. For instance, designing algorithms to promote diverse viewpoints, foster deeper connections, or encourage sustained learning, rather than solely optimizing for click-through rates, would be a major shift towards a beneficial influence.
That sounds like a monumental task. On a more practical level, Dr. Mihira, how do we effectively train society, from individuals to institutions, to interact with AI in a way that maximizes positive output and mitigates negative consequences?
It certainly is a challenge, but an achievable one. Education is foundational. This isn't just about teaching coding. It's about fostering AI literacy. People need to understand not just what AI does, but how it operates, its limitations, its biases, and its potential psychological effects. This should begin in schools, integrating critical thinking about digital environments into the curriculum. For adults, public awareness campaigns, accessible workshops, and clear guidelines from governing bodies are vital. It also involves empowering individuals with tools to manage their digital environments, to understand and adjust their privacy settings, to recognize algorithmic manipulation, and to consciously disengage when necessary. Think of it as digital hygiene, an essential skill for the 21st century. Regulation also plays a role in setting guardrails, but genuine societal adaptation comes from informed and empowered individuals.
The topic of privacy invariably arises when discussing AI. With vast amounts of data being processed, are humans inevitably losing their privacy as AI becomes more prevalent? Dr. Mihira, is it an unavoidable trade-off for convenience and personalization?
The perception of privacy loss is certainly high, and for good reason. AI thrives on data, and the more data it has, the more effective it can be at prediction and personalization. However, I wouldn't say it's an inevitable complete loss, nor an unavoidable trade-off. It's a design choice, coupled with regulatory frameworks. Innovations in federated learning and homomorphic encryption, for instance, allow AI to learn from data without directly accessing or centralizing personal information, preserving individual privacy while still enabling powerful AI capabilities. The challenge lies in shifting the paradigm from data extraction and monetization to privacy-preserving AI solutions. Public pressure and robust legal frameworks are essential to push for these ethical and technological advancements. It requires a societal commitment to privacy as a fundamental right, not a luxury.
That gives us some hope. Finally, Dr. Mihira, the big question. In this evolving landscape, will humans ultimately retain control over AI? Or do you foresee a future where AI exerts dominant control over human decisions and societies?
This is arguably the most critical question. The trajectory is not predetermined. It hinges entirely on the choices we make today regarding AI's development and governance. If we design AI purely for efficiency and optimization without integrating human values, ethical constraints, and mechanisms for human oversight and intervention, then the risk of AI subtly, or even overtly, controlling aspects of our lives certainly increases. However, if we consciously build AI as an augmentative tool, one that enhances human judgment, decision-making, and creativity, rather than replacing it, then we maintain agency. The responsibility rests with developers, policymakers, and indeed, every individual user. We must ensure that AI remains a servant to humanity, not its master, by prioritizing human-centric design and robust ethical guardrails from the outset. It's an ongoing negotiation between technology and humanity.
Extract 2. Questions 37 to 42. You hear a physiotherapist at the Mihira Research Institute talking about the importance of posture in the workplace.
Good morning, everyone, and welcome. It's a privilege to be here representing the Mihira Research Institute. Today, I want to talk about something that profoundly impacts our daily lives, often without us even realizing it: the importance of posture in the workplace. This isn't just about sitting up straight. It's about a foundational element of our physical and, indeed, mental well-being. We chose this topic because, despite widespread awareness campaigns, the prevalence of musculoskeletal complaints directly linked to prolonged static postures at work continues to escalate. In our clinics at Mihira Care, we've observed a concerning trend: an increasing number of individuals presenting with chronic neck pain, lower back discomfort, and repetitive strain injuries, all primarily stemming from suboptimal workstation ergonomics and poor postural habits. The modern professional spends an inordinate amount of time seated, glued to screens, and this sedentary existence, when compounded by poor alignment, doesn't just cause aches. It has significant long-term health implications, from degenerative disc disease to impaired circulation. Recognizing this pervasive, yet often underestimated, health challenge made it imperative for Mihira Care to highlight actionable strategies for prevention and management. We believe that addressing this at its roots is key to fostering a healthier, more productive workforce. The significance of maintaining optimal posture extends far beyond simply avoiding pain. A correctly aligned spine allows for efficient distribution of body weight, minimizing stress on ligaments, joints, and muscles. This isn't merely about comfort, it's about anatomical efficiency. Good posture enhances respiratory function by allowing the diaphragm to move freely, improving oxygen intake and reducing fatigue. It can positively influence mood, confidence, and even vocal projection, contributing to a more assertive and engaged presence. Conversely, sustained poor posture contributes to muscle imbalances, compressing nerves, restricting blood flow, and creating painful trigger points. It literally saps energy, making everyday tasks feel more arduous and dulling cognitive sharpness. At Mihira, we emphasize that proper posture is an investment in your long-term vitality, preventing a cascade of secondary health issues. Implementing effective postural habits requires conscious effort and strategic adjustments. Firstly, ensure your chair provides adequate lumbar support, maintaining the natural curve of your lower back. Your feet should be flat on the floor or a footrest, with knees at about a 90-degree angle. Your computer monitor should be at arm's length, with the top of the screen at or slightly below, a level to prevent neck strain. Your keyboard and mouse should be close to your body, keeping your elbows close to your sides. Regular micro breaks are non-negotiable. Every 30 to 60 minutes, stand up, stretch, and walk around briefly. Actively engaging your core muscles throughout the day, drawing your navel gently towards your spine, also provides crucial spinal stability. These are not merely suggestions but foundational practices advocated by Mihira for sustained well-being. While conscious effort is paramount, various assistive devices can provide invaluable support in maintaining good posture, particularly in prolonged work settings. Ergonomic chairs, for instance, are designed to support the spine's natural curvature and distribute pressure evenly. Lumbar support cushions can be added to existing chairs to fill the gap in the lower back. Standing desks, whether full units or desktop converters, encourage dynamic posture and reduce static load. Monitor risers ensure your screen is at the correct height, preventing forward head posture. For those with specific wrist or forearm issues, ergonomic keyboards and vertical mice can alleviate strain. Investing in these tools, when necessary, forms a critical part of Mihira's holistic approach to workplace wellness, complementing active postural awareness. While these tips and tools can prevent many issues, it's vital to recognize when professional intervention is required. If you experience persistent pain that doesn't resolve with rest or basic adjustments, if numbness or tingling develops in your limbs, if you notice significant limitations in your range of motion, or if symptoms worsen despite consistent efforts at home, it's time to seek a physiotherapy consultation. Red flags like sudden, severe weakness, bowel or bladder changes, or unremitting night pain warrant immediate medical attention. Delaying a consultation can often lead to more complex and entrenched problems. At Mihira, our physiotherapists are equipped to provide thorough assessments, pinpoint the root cause of your discomfort, and develop a personalized treatment plan, ensuring you get back to optimal function. Spreading awareness about optimal workplace posture requires a multi-pronged approach beyond individual consultations. Workplaces can implement regular workshops and seminars, perhaps collaborating with specialists from Mihira to educate employees on ergonomic principles and self-assessment techniques. Developing easy-to-understand educational materials like infographics and short videos for internal communication channels can be highly effective. Designating posture champions within teams can foster peer-to-peer encouragement. Crucially, securing management buy-in is essential, as their commitment sets the tone and provides resources for ergonomic assessments and necessary equipment. Integrating posture guidelines into new employee onboarding processes ensures early adoption. By embedding these practices into the company culture, we can create an environment where good posture is not just an individual responsibility, but a collective priority, safeguarding the long-term health of the entire workforce.